Every country in the world is now party to at least one human rights treaty that addresses health-related rights. Yet, harmful laws, policies, and practices routinely interfere with access to health care and increase vulnerability to ill health, particularly for poor, marginalized, or criminalized populations. This year's International Nurses Week celebration has the theme Nurses, a voice to lead, health is a human right. Nursing is a true calling. It's a physically demanding position. Many nurses cycle through 12-hour shifts on their feet. They give up holidays with their families and work through nights and weekends. This selflessness is also reflected in their commitment to their patients. Nursing professionals wear a hundred hats: caregiver, administrator, technician, troubleshooter, liaison, and countless others. We are on the front lines of administering and evaluating the patient's treatment. Therefore, we are the patient's greatest advocate. And as a healthcare provider, the health is a human right movement should be the top of our advocacies. Since we have the most direct contact with patients, have a unique perspective, and also have the largest workforce in all the healthcare professions with more than 20 million of nurses around the world, our voice is undeniably significant in the community. Understanding health as a human right creates a legal obligation to ensure access to timely, acceptable, and affordable health care of appropriate quality as well as to providing for the underlying determinants of health, such as safe and potable water, sanitation, food, housing, health-related information, education, and gender equality. There are four components of a right to health. First, availability refers to the need for a sufficient quantity of functioning public health and healthcare facilities, goods and services, as well as programs for all. Second, accessibility requires that health facilities, goods, and services must be accessible to everyone. Accessibility has four overlapping dimensions: non-discrimination, physical accessibility, economical accessibility, and information accessibility. Third, acceptability relates to respect for medical ethics, culturally appropriate, and sensitivity to gender. Acceptability requires that health facilities, goods, services, and programs are people-centered and cater for the specific needs of diverse population groups and in accordance with international standards of medical ethics for confidentiality and informed consent. Fourth, quality. Facilities, goods, and services must be scientifically and medically approved. Quality is a key component of universal health coverage and includes the experience as well as the perception of healthcare. Quality health services should be safe, effective, people-centered, timely, equitable, integrated, and efficient. As nurses, we are leaders and we have the voice to promote that health is a human right. You are an expert. You are expected to be knowledgeable regarding your practice and other factors relating to health and it being a human right. You are an educator. You have the responsibility to educate your colleagues, patients, and other people regarding health without discrimination. You are an advocate. As a healthcare provider, you believe, support, and promote the cause and importance of health in the community. You are a model. Take the initiative to practice health as a human right and follow the regulations, may it be a local or international policy such as the organization's sanitary and patient rights protocol. You are a voice. Be educated and get involved. You are a nurse. You have the voice to lead. Remember, health is a human right.